topical carbonic anhydrase inhibitors in treatment of juvenile X-linked retinoschisis, big data study.
Is Dr. Sindhuja there?
Yes.
Dr. Sindhuja.
Good morning, everyone. I'll be presenting a study on topical carbonic anhydrase inhibitors in treatment of juvenile X-linked retinoschisis, a big data study. So these are the abbreviations I've used. So juvenile X-linked retinoschisis is a disease with an incidence between 1 in 5,000 and 1 in 25,000 males. It has a foveal schisis with splitting of the inner retinal layers, which is seen in 81 to 94% of the cases. So Paola et al. Showed that visual acuity improved significantly after one cycle of carbonic anhydrase inhibitors with a sample size of 36, whereas Melanie et al. In their study of 18 eyes for a mean of 8.3 years showed that visual acuity improved, which was significant. This brings us to the need for a large study, thus enhancing our idea about the natural history of the disease. The purpose of our study was to report the efficacy of topical carbonic anhydrase inhibitors in treating juvenile X-linked retinoschisis, to look for the variation in visual acuity in logMAR units and variation of central subfield thickness in microns with topical carbonic anhydrase inhibitors. This is a retrospective review of records conducted in LV Prasad Eye Institute from a period of Jan 2014 to December 2024, which included 94 eyes of 50 patients. The demographics, symptoms, clinical features, and OCT findings were analyzed using appropriate statistics. The inclusion criteria and exclusion criteria were well defined, with a mean age at baseline which was 14.49 years, with an average follow-up of 45.44 months and a maximum follow-up of 96 months in 4 eyes. Total compliant patients were 86 and non-compliant being 8. Coming to the results, half of the visual acuity, half of the patients showed an improvement in visual acuity with a maximum of 63.8% improved by one line. 23.4% of the patients showed a decrease in vision with a maximum 40.9% dropped by one line. 25 patients had no change in vision. Out of the 22 patients with decreased vision, 4 actual had an increase in central subfield thickness, and the rest 18 had a decreased central subfield thickness in the last follow-up. This box plot representation shows improvement in visual acuity from around halfway point in the series of visits, which may be indicative of the effectiveness of the treatment being assessed. The consistency in the spread of measurements and the pattern of outliers could suggest a convergence in visual acuity measurements among the participants as the visit progresses. So this is a two-case honestly significant difference analysis test, which shows large estimate and wide confidence interval between 9th follow-up and baseline visual acuity, indicating a possible improvement. Coming to the central subfield thickness, this is a depiction of our patient showing reduced central subfield thickness in the follow-up. This box plot effectively provides a visual representation of the distribution of central subfield thickness measured across different time points, showing numerous outliers, particularly during the early visits, which decreased in later visits, suggesting a convergence in central subfield thickness measurements among the participants. So this two-case honestly significant difference test shows there was initial reduction in CST after commencing the carbonic anhydrase inhibitors, suggesting a successful initial intervention, with fluctuations in CST around visit 3 and 4 and a significant decrease in CST at visit 6 and 7, indicating treatment effectiveness, potentially indicating a therapeutic response, and a slightly increased CST in later visits, which might suggest stabilization. So beneficial effects of carbonic anhydrase inhibitors may be due to enhanced retinal adhesiveness to the retinal pigment epithelium, increased retinoschisin production, or removal of retinoschisin from the cystic spaces, which would not necessarily result in reduction in the CST. The presence of long-standing retinal cysts can ultimately be associated with development of atrophic macular lesions and further loss of visual acuity. So this study highlights that although structural changes occur with carbonic anhydrase inhibitor treatment, they may not directly translate into visual gains, thus showing the treatment is not only preventing the schisis in the macular area from increasing, but it may be help stabilizing the vision, if not improve the visual acuity. This is the first time a large population is being studied. So we will further require a longer follow-up, and the confounding factors may be the compliance of the patients and also the age at presentation, probably how many years the patients have been using carbonic anhydrase inhibitors from the age of presentation, which could also change the final outcome.
Was there a control group?
No, sir.
So then we don't know, is it because of carbonic anhydrase inhibitors or it is just coincidental? That possibility would be there. I think there should have been a control if you're doing a prospective study, in my mind.
This was a retrospective study, sir.
So it's a retrospective study.
Retrospective.
So you've taken data and you have seen
Yes,
that. Okay.
So how long was the treatment duration for the patients?
10-year study, ma'am, with an average of 45 months.
No, I'm asking for each patient per se. What was the average duration of the treatment when you were using these carbonic anhydrase inhibitors?
So we have patients, the longest that we followed were 8 years, and then there are
They were
starting
there
from 2
for
years.
8 years
Yes.
for continuously on CI?
Yes, yes.
Normally we
be-
don't
no.
give for so long,
There will
do
be
we?
compliance
Do we?
issues
Normally
also.
we don't give for so
Compliance
long.
issues were also there, ma'am. In between, there were people that stopped, and then they were restarted. So we called them at 6 months interval.
Actually, I am like, even Vinod was collecting some data from RPC, from AIMS Delhi, and I was along with him doing that study when I was in Delhi for some time. So I have seen in those cases, you don't need to give carbonic anhydrase so long, because once the macular subfoveal thickness, it stabilizes, those cysts and cyst cavities start reducing.
Yes.
Okay, you need not continue, because then the side effects of all these drops will start coming in. So I don't know, probably because your study was a retrospective study, probably you have not noted the period duration of treatment given to these children.
Okay, I'll
That should have been taken into consideration, because otherwise you can't give it for so long. The therapies are usually not given for so long.
And children particularly.
So in many the vision increased, in many the vision decreased. So is the treatment working? I mean, it's not like
in
everyone
20
increase and some increase more, some increase less, and some decrease
right.
also. So, and you're giving for 8 years, so is it really
So in
working?
22 patients, the vision decreased, but then what we found out was the CST actually did not increase. So that was, it could be due to macular atrophy eventually that happened.
There are more things which can be documented in this,
Yeah.
and further deeper look is.